is I want to note that although the governor's office order regarding establishing a quorum for public entities during the pandemic via virtual attendance expired, some of our members are appearing by teleconference today. We do, however, have a quorum on hand, and you can see that we are seated to accommodate state and federal recommendations regarding social distancing related to the current public health emergency. We are also continuing to streamline our meeting process to avoid non-essential items from our consideration. And the other required reading is any citizen desiring to address the hospital board turn in a speaker card to our board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking the hospital contract awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, the administration, legal counsel to review and negotiate a settlement on claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. Okay. So the first item is the approval of the orders of the day. Sarah?
I move approval of the orders of the day as published with one amendment, the addition of item 2. Under legal reports to approve a waiver for outside board service for Mr. Barrender.
I'd ask for a motion to approve.
Second.
All those in favor respond by saying yes.
Yes.
Motion carries. Thank you. Approval of the minutes of the meeting of August 16, 2021. May I have a motion, please?
Second.
All those in favor respond by saying yes.
Yes.
The notes are accepted. Board reports. There are no board reports. Medical staff reports. If we start with Dr. Fiorica.
Yes, on behalf of the leadership of the medical staff of SMH Sarasota and SMH Venice, I'd like to ask for a motion for approval of the following 7 joint peer review policies. They include the peer review policy, the focused professional practice evaluation policy, the ongoing professional practice evaluation policy, the medical staff professionalism policy, the practitioner health policy.
So moved.
On practitioner access to confidential files, and the policy for review of concerns related to utilization.
This is Gerald. I so move.
Saying yes, please.
Yes.
Opposed, motion carries. Thank you, Doctor. Next is our Chief of Staff, Dr. Wazin.
Dr. Wazin couldn't make this meeting, but I'd like to, on behalf of Dr. Wazin and the leadership of SMH Sarasota, I'd ask for a motion approving the Sarasota physician privileging forms for general surgery, complex oncology surgery, and vascular surgery as recommended by SMH Medical Executive Committee.
Those in favor respond by saying yes.
Yes.
Opposed, the motion carries. Our Venice Chief of Staff, Dr. Jefferson, please.
I would ask for a motion approving Sarasota Memorial Hospital Venice physician privileges forms for general surgery, complex oncology surgery, pediatric neonatology care, and vascular surgery, and for advanced practice professional privileging forms for neonatology as recommended by the SMH Venice Medical Executive Committee.
We have a second.
Second.
All those in favor, please say yes.
Yes.
Opposed? Carries. Thank you, Doctor. Secretary's report, Sarah Watch, please.
Yes. Our next board meeting will be Monday, October 18th, 2021. From 9 to 10:30, we'll have Mission and Planning Committee. From 10:30 to noon, we'll have Quality Committee. From noon to 12:30, we'll have a closed session hospital board meeting. From 12:30 to 2, financial review, board issues, and board lunch. From 2 to 4, board meeting. And from 3:30 to 4:30, corporate compliance immediately following the board meeting.
Thank you. Treasurer's report, Joseph E. Virgilia, please, Joe.
Yes, thank you, Jim. I have one motion, and I move approval of the bad debt and charity care for the month ending August 31st, 2021, in the amount of $22,046,000.
You have a second, please? Second. All those in favor respond by saying yes.
Yes.
Opposed, motion carries. Thank you, Joe. Next is Bill Volgen, our Chief Financial Officer. Bill, please.
Thank you, Mr. Chairman. I have the financial highlights for August, and we'll start with total revenue. Total revenue for the system for the month of August was $101,827,000, compared to a budget of $93,660,000. Fiscal year to date, and this represents 11 months of activity, total revenue of $1,136,372,000, compared to budget of $1,019,076. The total expenses for the system for the month of August, $101,146,000, compared to a budget of $88,993,000. Fiscal year to date, total expenses, $995,626,000, compared to a budget of $962,633,000. Operating income for the system for the month of August, $681,000, which generated an operating margin of 0.7%, compared to a budget of $4,667,000, budgeted operating margin of 5%, and that was depressed by the effect of the COVID surge. Fiscal year to date, again through 11 months, operating income of $140,746,000, compared to a budget of $56,443,000. Our operating margin through 11 months is 12.4%. We had budgeted 5.5%. Moving to statistics for the hospital, and these are all fiscal year to date numbers. Average daily occupancy is 655 patients per day, compared to a budget of 597. The average acute length of stay, 4.72, and a year ago was 4.51 days. Admissions, so far through 11 months, we have 40,906, compared to a budget of 40,581. Surgery cases through 11 months, 21,777, compared to a budget of 22,949. And we have 3,600 births so far this fiscal year, compared to a budget of 3,683. Outpatient registrations, 452,097, compared to a budget of 442,800. Emergency care registrations between our two ECCs, 107,791, compared to a budget of 112,907. And our case mix index so far, all patients, 1.87, and for Medicare patients, Mr. Chairman, that concludes my report.
Yes.
Thank you, Bill. Any questions for Bill? Hearing none, thank you. Next up, Investment Committee, Cheryl Lodge, Chair, please.
Thank you. Colin Robertson of Northern Trust gave a presentation on fixed income update and portfolio review, which included a review of economic activity and interest rates. Colin presented information on the board designated funds investment results as of June 30th. The enhanced cash fund had a return of 0.06 through the first 6 months of 2021 and 0.24% over the past year. The intermediate fund had a return of negative 0.72% during the first 6 months of 2021 and 0.51% over the past year. Both portfolios are invested in high-quality securities. Tim Sand of Pavilion presented a report on the equity market environment and the performance of various market indexes. The retirement plan portfolio of assets gained 4.93% during the second quarter of 2021 and 23.9% over the past 12 months. This strong performance has been largely driven by gains in our domestic equity investments. Tim also reported that as of August 31st, the retirement plan fund had a market value of $460 million, and the strong returns have driven the retirement plan to be approximately 108% funded as of August 31st, 2021. This concludes my report.
Thank you, Sarah. Sarah, right back to you, Chairman of the Audit Committee, please.
Sure. A meeting of the Audit Committee was held on September 20th, 2021. Bill Wojcik, CFO, reviewed and requested to increase the district's fiscal year 2021 capital budget for equipment purchase to fight COVID-19. I move approval of an increase to the fiscal year 2021 capital budget in the amount of $518,561 to reflect equipment purchase to fight COVID-19 as recommended by the Audit Committee.
May I have a second, please? Second. All those in favor respond by saying yes.
Yes.
Opposed, motion carries. Continue, please.
Nay.
Todd Nass, Director of Audit Services, reviewed the Audit Services Annual Audit Plan for 2021 and 2022. There was a discussion and consistent with that, I move approval of the 2021 and 2022 Audit Plan as recommended by the Audit Committee.
May I have a second, please? All those in favor, please respond by saying yes.
Yes.
Opposed? It carries. Thank you very much. Up next is David Barrett, our President and Chief Executive Officer.
Yes, thank you, Mr. Chairman. We have, I'm going to start like I do each month, we look at our organizational report card. We have 5 areas of focus that we look at, and I'll start with the first one in service. We have a goal of having our likelihood of recommending our number of services greater than or equal to the 75th percentile, being 8 out of 10. Happy to report we are meeting that goal, and we're at 8 out of 10, and I'll show you the detail on that here in a minute. In the people focus, we have our new hire retention. Our goal is to have our percentage of regular, full, and part-time employees that are hired in FY 2021 still be employed as of September 30th, 2001. We had a goal of being at 83% or higher. Happy to report that we are exceeding that goal as well at 89.11%. In the quality area, we have our goal of having our infection prevention, which is our combined overall standardized infection rate. I'm happy to report that we are exceeding that, and we're coming in at 0.70. And just to remind the board that a 1.0 would represent an expected or a national average number, so we're quite a bit under that. In the finance area, you've already heard our CFO, Bill Wojcik, give a report. Our goal is to have our operating margin meet our budget, which is 5.5%. We are projecting that we're going to exceed that in the fiscal year 11.8%. And finally, we have 2 goals under the growth area. The first being inpatient admissions and outpatient observation outpatients. Having our goal be at 51,164 for the year, we are projecting that we're going to exceed that at 52,456. The second goal is being outpatient registrations. That goal is set at 977,000, and we're projecting to exceed that as well at 985,000. Looking at the patient experience report card in detail, what you have in front of you is our likelihood of recommending the 10 different areas that we look at on the far left. The middle column is the score that we've achieved year to date for fiscal year 2021. The next column over, the first green column, is the national median score. And then finally, the far right column is the 75th percentile score. You can see that we have made, in 8 departments, we've beat the 75th percentile, and we have 2 that are lacking. Both ERs, one is, of course, in the main campus, and one is in Northport. As I think everyone is well aware, August is a very challenging time in both our ERs during the run-up of COVID. However, I do think we have something to celebrate that we were able to maintain all 10 departments at or above the national median score. SMH is providing monoclonal antibody treatments to more than 1,000 community members. Evidence indicates outpatient antibody infusion therapy can help prevent severe COVID illness and hospitalization in high-risk outpatients if given within 10 days of symptom onset. SMH has been one of the earliest providers of this treatment in our community, delivering the therapy to more than 1,000 patients since November 2020. Demand grew during the surge from 85 patients in July to over 400 in August. Our teams have the capacity to infuse up to 24 patients per day in 2 locations. And then we give you the information if you're interested, phone number to call, and we are still staffing Monday through Friday. So COVID-19 vaccine update. Widespread vaccination is a critical tool along with the masking and social distancing for stopping the pandemic. Since the COVID-19 vaccine became widely available earlier this year, SMH has implored staff and community members to get the shot as quickly as possible. To help boost employee vaccine rates, SMH is offering a special incentive to staff who are fully vaccinated by October 1st, 2021. A large majority of our team members have already stepped up to do the right thing. To date, about 3/4 of our 7,600 employees and about 90% of our 1,000+ medical staff members have gotten a shot. SMH will be reviewing rules related to the federal government's recently announced mandates and will develop policies accordingly. Labor and delivery teams celebrate record month. SMH welcomed 415 babies into the world in August, setting a new record for our labor and delivery team. Congratulations to the hundreds of Sarasota Memorial patient families who delivered during this milestone month, including one pictured here. Many thanks to each of them for choosing our healthcare system for one of life's most important moments. And I will tell you, I think as we've been sitting in this boardroom today, Mr. DiPatrulio, how many have we counted now?
I think it was
6 or 7 must have been delivered today because we've heard the lullaby.
Is that a picture of Rick?
I don't think it was a picture of her now. RN shares story of COVID during pregnancy. The CDC recently updated its guidance to recommend COVID-19 vaccines for all women who are pregnant, breastfeeding, trying to get pregnant, or might become pregnant in the future. The guidance echoes the American College of Obstetrics and Gynecologists and the Society of Maternal Fetal Medicine, which both recommend vaccination during pregnancy due to the increased risk of severe illness from COVID-19. Brittany Campella, RN, a labor delivery nurse at SMH, was among 50+ pregnant patients with COVID-19 treated at SMH in August. She shared her story in a video along with maternal fetal medicine specialist Dr. Felice Barron to encourage other women to get the shot. And we have a link on our website and on the presentation in front of you. It's a pretty compelling video if you take a watch. Community members thank staff on Labor Day. Thank you to our community for continuing to support SMH throughout the pandemic. A group of community members rallied outside SMH on Labor Day to support our team. And I will tell you, those signs and people out there that sit out there in that very hot day, it meant more to those nurses that are standing up in those units than you can imagine. So thank you to the community members who came out and did that. Construction update, SMH Venice. Installation of computers, mobile equipment, and furniture is ongoing. Operational leaders are on site preparing the OR, cath labs, pharmacy, and lab for patients. Final paving and landscaping installation is underway. Hiring our full-time and part-time staff exceeds 88%, and the project remains on budget and on schedule to open in the fall of 2021. And Sharon's here today, and Sharon, it is just beautiful what's going on down there. Thank you. Construction update on the Brian D. Jellison Cancer Institute Tower. The fire alarm system test starts in September 21st. Final traffic pattern is in place. Finalizing interior connections to existing facility. ACA 95% inspection complete on levels 2 through 7. ACA 100% inspection scheduled for completion in fall 2021. And the final state licensure inspections scheduled also for fall 2021. And Lori, once again, the project looks great. Thank you. And that is my report. I'm happy to answer any questions if you want to ask.
Any questions? David, I know I speak on behalf of the board. These have been very, very, very difficult times in business, no matter what people's business. And being the chief executive of the #1 hospital in this market and being a role model for our physicians, over 7,000 associates, come to work every day, tired, run down, see the vision of being a leader, caring, quality, innovative medicine. As a result of your leadership, your team here and elsewhere, and I know I say on behalf of the board, well done. Very, very well.
Thank you, Jim, and thank you all. I will tell you, it's not a testament to myself. It's a testament to all of our team members. We have 7,600 people here who rush to emergencies, who rush into fires, and they're heroes every day. We have 1,500 medical staff members who do the same thing, and that's why this place is as special as it is. So thank you. I'll convey your message.
Okay, Karen, do we have any person or persons willing
Yes, sir, we
to
have one.
speak?
Yes, sir, we have one. I have it up there for you.
Okay, is this on the speech paper? Okay, we have a Mr. Larry King who would like to speak. Mr. King, you welcome, and you have 5 minutes, which will be monitored by our chief legal officer. So the floor is yours, please.
How about we just do it right here?
May I get you to return?
I'm sorry.
I have, it's not homework.
Hey, Mr. Chairman, could you have him speak closer to the microphone so we can hear it?
The speaker does have a microphone, Mr. Hudson.
Yes.
Okay, thank you.
Can anybody hear me? I'm not microphone qualified.
You're okay. You're good.
Thank you. I had everything planned until I got here. And I know the excellence of the work that we do. And sitting here, I'm even more impressed.
There's a very strong simultaneous echo to the voice.
I was believing
That's why it's
gratitude
hard to
early
hear.
on. You know, 2 hospitals coming up, you know, from brings to patients. And that's awesome. I know the good work that Sarasota Memorial Hospital has done historically. I was born on the same year as my mom in 1925. I spent a lot of time reading about Sarasota Memorial Hospital. I worked at other hospitals, and I figured one day I would end my career at Sarasota Memorial Hospital. I left Palmetto, moved to Venice, and I set a timetable. And when I saw that the hospital was coming out of the ground, I tried to make contact with Sarasota Memorial Hospital. I waited till the right time, and I called and asked for some assistance because I realized my resume didn't look that great because I had a couple of days off. And even though I have over 35 years of experience and a severe love affair with patient care, I called and asked for assistance, but nobody picked up the phone. Nobody answered the call. And when I kept calling, and months and months and months and months later, I met one person in the whole hospital that picked up the phone, and her name was Assistant Secretary Administrator Karen Marshall. And I'm here today because she said that I did come and speak. I don't have anything new to tell you. I could compliment the excellence that I know that you do. I came down 7 flights of stairs, and I can walk up 7 flights of stairs. I'm a competitive bodybuilder and a triathlete and a long-distance swimmer. I was in the ocean yesterday. It was over an hour to get back, about a mile and a half. And I was thinking what I could say, and I had 1,000 things to tell you, and everything that I could tell you, you already know. I'm, at this time, just requesting if somebody could hand one of those papers to the Director of Human Resources, and maybe somebody would have a look at that. I spent my whole life writing letters to people, and as a nurse, I wrote letters for other people that couldn't write or couldn't speak. I grew up on Miami Beach, and my first love was elderly people. I always managed to do the right thing. Yes, I had problems as a kid. I didn't do drugs, I didn't drink. I've never had a cup of coffee, I've never had a cigarette, I've never had a coffee break. I spent most of my 30-some years on the floor, never sitting down for the 16 hours. So I couldn't run for public office, so I didn't have that work behind me. But patient care I was good at. Back when I got out of the service, I got a state pool license, and I pulled a lady out of the swimming pool and I did CPR until Miami Beach Fire Rescue saved me. She came back to see me a couple weeks later with her broken ribs, and she offered me my $5 tip. But at that time, there was a man there, and he came to me and said, "Boy, kid," he said, "if you save one person's life, you save the world." And I realized at that time that's all I wanted to do, and that's what I've done my whole career. I only have 2 speeds, fast and faster. And if you give me the chance to be part of that emergency room team in the new ECC at the Venice Hospital, which is exactly 10 miles from my Harley Davidson, and I passed a sign that said SMH, we're looking for workers, so I stopped there and I read the sign, and I'm at home at the same time. I get, thousands of emails from Indeed and that other guy too that you didn't mention, ZipRecruiter, Phil. He's a good friend of mine. He writes to me every day, tells me, Sarasota Memorial Hospital is looking for you. You'd be a good fit at Sarasota Memorial Hospital. Why don't you call Sarasota Memorial Hospital? Well, when they had the, I applied for 30 positions, including, I grew up in hospitality, so I'm excellent in the kitchen. I can cook and clean, and I love cleaning. And if I don't do good here today, my wife will take away my cleaning privileges at home, and that's terrible. Well, I applied for 30 positions, and I'm not qualified for any of those.
Thank you so much. Your 5 minutes are up.
Thank you. I look forward to maybe somebody will at Human Resources would have a look for me. God bless you.
Thank you, Larry. We'll make sure it gets, this letter gets to HR. Thank you, Larry.
Thank you.
I was an honor guard soldier.
Okay, Carol Ann, you have a legal matter?
There are a couple of resolutions that I'm going to read related to amending the retirement plans. They reflect some drafting housekeeping that needs to be done to keep our retirement plans in line with the ever-changing regulations that relate to them. So I will read those, and then, if possible, we could have a motion approving them. There are 2 resolutions. One is a resolution authorizing amendments to the SMH Healthcare Retirement Plan. Whereas the Sarasota County Public Hospital District, hereinafter referred to as the district, is an independent special district created pursuant to Chapter 2003-359 laws of Florida, as amended, hereinafter referred to as the Act. with jurisdiction extending territorially through all of Sarasota County, Florida, and is governed by the Sarasota County Public Hospital Board, hereinafter referred to as the Board. And whereas the SMH Healthcare Retirement Plan, hereinafter referred to as the plan, was last restated effective October 1, 2015, and whereas Article 17 of the plan authorizes the district to amend the plan, and whereas the district desires to amend the plan to clarify that the plan is closed to new entrants and re-entrants, modify the optional forms of payment that may be selected by death beneficiaries to be more similar to the options that may be selected by members, and clarify the treatment of ongoing employees transferring between eligible employee and non-eligible employee positions and retirees in pay status who return to employment. Now, therefore, the Sarasota County Public Hospital Board does hereby resolve as follows. The board hereby approves the First Amendment to the amended and restated plan document that was effective October 1 of 2015. The amendment is effective October 1 of 2020, except as otherwise provided, and that this resolution shall take effect immediately upon passage. And if passed and adopted, this will be signed by Jim Meister at the close of this meeting.
So moved. Can I have a second, please? All those in favor respond by saying yes.
Yes.
Opposed?
No.
Thank you, Chairman.
Sure, I have one more. This is a resolution approving the amendment and restatement of the First Physicians Group Retirement Plan. Whereas SMH Healthcare Inc. maintains the First Physician Group Retirement Plan, which hereinafter will be referred to as the plan. And whereas SMH Healthcare Inc. is controlled by the Sarasota County Public Hospital District, hereinafter referred to as the district, an independent special district created pursuant to Chapter 2003-359 Laws of Florida, as amended, hereinafter referred to as the Act, with jurisdiction extending territorially through all of Sarasota County, Florida, and is governed by the Sarasota County Public Hospital Board, hereinafter referred to as the Board. And whereas the plan is required to be updated for all required legislative changes through the 2017 cumulative list of plan qualifications requirements cycle 3, and other changes to reflect updated IRS regulations. And whereas the district is authorized to amend the plan, and whereas this update incorporates provisions the IRS now requires to be addressed in the plan and describes operational practices that went into effect in prior years with no new benefits or liabilities being created. And whereas the revisions do not alter current benefits or increase the district's funding obligations, now therefore the Sarasota County Public Hospital Board does hereby resolve as follows. The plan shall hereafter be known as the First Physicians Group Frozen Profit Sharing Plan. The board hereby approves the amended and restated plan, a copy of which is attached here too. Excuse me. Effective October 1, 2021, unless otherwise indicated in the plan document, on behalf of SMH Healthcare Inc., and the appropriate individuals are authorized to sign the applicable plan document and distribute appropriate summaries to participants and beneficiaries. This resolution also will take effect upon its passage, and if passed, will be signed at the close of this meeting.
I'll move it. Can I have a second? All those in favor respond by saying yes.
Yes.
Opposed? Motion carried. Thank you.
No.
And one last thing, one final thing, I think that Mr. DiVirgilio has a motion that was added to the amended orders of the day.
Did we get to have questions? You started taking the vote already?
Daryl, you'll have to speak up. I didn't hear you.
Did we get to ask questions before we take the vote?
Which do you have a question on?
The proposal to change the retirement stuff.
Okay.
I'm assuming we have, but I cannot hear it anywhere. Did we have a full look-see by HR if it made sense?
Those changes to both of those were to update the language, to recognize a number of things that Caroline had, the IRS is now requiring in it. In addition, it's also reflecting that we are now a system and not just the Sarasota Memorial Hospital any longer. But other than that, it was really, those were the changes. Nothing materially changed relative to benefits or cost to the system.
What benefit change occurred because of it?
No benefit changes are occurring whatsoever relative to the language changes.
Okay?
You good?
Heck no. I'm adequate.
Okay, thank you. All right, I have a motion here, and I move approval of a waiver of outside board service as required under paragraph 4.6 of his agreement for Mr. Verrier to serve on the board of an assisted for, that's the name of the outfit, assisted, the number 4 Living Incorporated, as requested by Mr. Verrier, after detailed disclosure, as this service would not interfere with the performance of his obligations under his agreement, does not create an actual or potential conflict of interest, and does not otherwise interfere with his performance of his agreement. That's my motion. Second.
All those in favor, respond by saying yes.
Yes.
Opposed?
I-
Motion
I had a question, but
Well,
Tran?
go ahead.
can you hear me? So was this just amending the contract to allow him to serve on another board, or is there a specific board he has requested permission to serve on? I missed that part of the conversation.
He has requested to join the board of this organization called Assist for Living, Inc. That's all we're authorizing.
Okay, and my question would be, is that a compensated board seat, or is that volunteer pro bono?
Yeah, Tram, at this time, there's no compensation on it, but I don't know if that holds for the future or not.
Okay, all right. And is this a private company, or is this a, what kind of organization is it?
It's a for-profit company.
Yeah. Okay. I guess I have mixed feelings on that one. And I'm sorry I had not asked this question earlier. It may have been in the packet. But I would have to vote no on that.
Okay. Having completed our, thank you, Tran. Having completed our agenda, we stand adjourned. The board will reconvene here in this room.
You didn't decide whether to vote yes or no on the motion.
Daryl, I voted no.
I know Tram did. I was about to vote no, but they never took a vote.
I think well, Mr. Chairman.
Will you vote again? Yeah. All those in favor, respond by saying yes.
Yes.
Those opposed, say no.
No.
Hudson votes no.
The ayes have it. Thank you. Having completed our agenda, we stand adjourned. The board will reconvene here for the final hearing of the budget and the millage rate at 5:01 promptly. Appreciate it. You're on time. Thank you.